Hi everyone, and welcome to the second part of the video, which discusses about depression. In the first video we talked about the core symptoms. Now we're going to talk about the causes and the management. So basically, depression, as I earlier said, is a mood disorder. The core symptoms: persistent sadness, lack of energy, and loss of interest in previously pleasurable activities, lasting at least a duration of 2 weeks. Now, to make an assessment of mild depression, you need 2 of the core and 2 of the other symptoms. To make an assessment of moderate depression, we need 2 of the core, 3 of the other symptoms. While for severe depression, you need 3, at least all 3 of the core and 4 of the rest. For further clarification, we can talk in private. The causes of depression. We can talk about childhood factors, events during the childhood, genetic factors, and then factors within the immediate recent past. Now, genetic factors: for people who have maybe a mother or a grandmother who has suffered depressive illness, that person is more likely to have depression in the future than somebody who has no family member that has suffered this kind of illness. Childhood factors like child abuse, parental loss, parental deprivation, severe poverty during childhood, those can also be a herald in the future for a depressive illness. Then also, in the recent past, loss events like financial losses, loss of a loved one, or role changes like transition from married to divorced, from single to married, from married to now having a child. All those periods are associated with significant stress, and they can lead to depressive illnesses. So how do we manage? Management of depression depends on the severity, and that's why I took time to talk about mild, moderate, and severe. So for mild depression, lifestyle changes, wellness packages can work for those. Simple counseling or talking to a close friend, having a confidant, having a good job where you go away from the stressful event, being able to work out, exercise, that decreases stress hormones and releases endorphins, which helps reduce a depressive illness or depressive symptoms. Yes, being able to do activities like yoga, breathing exercises, relaxation, all those help with mild. For moderate and severe depression, the mainstay of treatment is psychotherapy and medication. Now, for moderate depression, some people do psychotherapy alone. Now, this psychotherapy has to be conducted by a specialist, a psychotherapist, either a doctor or a psychologist. While for severe depression, the first treatment is medication. A lot of times it's actually hospitalization, medication. In some instances, you have to do what we call the electroconvulsive therapy. For some other forms of therapy, before, if the depression now reduces to moderate, that's when psychotherapy will be able to work. But for severe depression, the main thing is medication. There's quite a lot on depression. It's a very common illness these days, and it's likely to get a lot commoner as time goes by. How do we protect ourselves? How do we prevent it? Well, we're supposed to, one, know thyself. Know what your triggers are. Be able to set boundaries. Engage your time. Find meaningful activities for your days. Plan your time. Be able to say no when you need to. Manage your finances. For people who are going through relationship difficulties, find a therapist or try to manage it yourself. If it doesn't work that way, find a therapist. Find ways that you can create joy for yourself. Exercises, activities, yoga, dance, whatever helps. But the best thing is to prevent it so it doesn't happen. But once it does occur and you're within the sphere that needs medication, then take the medication diligently for the required amount of time so that you get out of it and it doesn't reoccur. As usual, if you know anybody who needs to watch this or listen to it, kindly send it to them, and then we'll meet in the next video. Thank you so much.